Okay, so here I'm with Professor Davor from Denmark, and he is leading the course on telepsychiatry and other digital tools for psychiatry. So, Professor Davor, first of all, congratulations for the first presentation. It was great. And I'd like you to talk a little bit about the history of telepsychiatry, because most people guess they think it's like a COVID-related event. And what you showed us, it's a much older process. Is that correct?
True. Telepsychiatry is something which we have known since 1959. At that time, technology was very expensive. TV cameras connected Massachusetts Hospital with Medical University. And during the decades, telepsychiatry developed in United States, Canada, Australia. Within last 30 years, we developed telepsychiatry in the rest of the world, and I introduced telepsychiatry to European psychiatry, where I developed some new approaches such as transcultural or cross-cultural telepsychiatry, where we connect patients and doctors that speak the same language. And it is very important in case we get refugees, migrants, and asylum seekers who do not speak the language of the host country. In such cases, all over the world, we invite interpreters, which increase the time, double up, which increase the expenses, and which decrease the chances to establish a good doctor-patient relationship. And that is why I made global guidelines for telepsychiatry when COVID started, as I knew how few of us have been practicing telepsychiatry and how huge need it was during COVID time, and it is still.
Perfect, Professor. And I also would like to say that Professor Davor is one of the pioneers, as you could see, on telepsychiatry. So it's a great honor talking to you, Professor. And one last thing, what would you say would be the main barriers for psychiatrists to implement this on their daily practice?
The main barriers for psychiatrists to implement new things are the same as barriers for anybody else to implement something. First, you need to change the software in your head to be open for the new technologies and combine your knowledge with your common sense. Technology is here to stay. We cannot stop the development of technology. That's why I think it's important to learn about technology, in this case, about how we speak through video. It is not a simple Viber or Skype or Zoom consultation. Those guidelines which I made are very practical. There you can learn what to do, what not to do. And within this here WPA conferences, we have 4-hour CME courses where people can learn what to do, how to set up the service, and what is absolutely to avoid within remote consultations. So if you are new in the field, I will suggest to read a little bit, to see home pages. I have few, but it is easy to find videos on YouTube about video consultations, and to download for free Telepsychiatry Global Guidelines of WPA published 2 years ago, and already it would be a good start.
Perfect, Professor. Thank you so much for sharing your knowledge, and I'm looking forward for your next talks. Thank you.
Thank you for inviting me. Thank you so much. Bye.